Hello everybody, welcome back to Dogshala. Today in this video of NEET MDS 2021 Recall series, we are going to see about an interesting topic, that is thyroglossal duct cyst, from the subject General Surgery. So what is a thyroglossal duct cyst? So it is a fibrous cyst that forms from a persistent thyroglossal duct. Okay, it is a fibrous cyst that forms from a persistent thyroglossal duct. It can be defined as an irregular neck mass or a lump which develops from cells and tissues that are left over after formation of thyroid gland during developmental stages. So it is an irregular neck mass or lump that develops from cells and tissues that are left over after the formation of the thyroid gland during the developmental stages. So may develop at birth also. Okay, so it is a midline neck lesion. Okay, since it is developing from the leftover cells and tissues of thyroid gland, it is a midline neck lesion. So it is present in the midline of the neck. Okay, so it originates from the base of the tongue at foramen cecum and descends through the central portion of the hyoid bone. So this is the extent of the lump. So from this image here you can appreciate that. So it is present in the midlines of the neck and it is originating from the base of the tongue at foramen cecum and descends through the central portion of the hyoid bone. Okay. Then coming to the signs and symptoms that it presents with are, so it is a palpable asymptomatic midline neck mass. Okay, so we can palpate the mass. It is located below the level of the hyoid bone. So it moves during swallowing or on protrusion of tongue. So it moves during swallowing or on protrusion of tongue. It moves up and down during swallowing or on protrusion of tongue because of its attachment to the tongue via the tract of thyroid descent. So it is attached to the tongue via the tract of thyroid descent. So it also presents with throat pain or dysphagia. Dysphagia is nothing but difficulty in swallowing. So coming to the complications that we see with this thyroglossal duct cyst are, it can present with infection if it is not removed at the correct time. It can also develop into a thyroglossal fistula. It can also develop into a thyroglossal duct cyst carcinoma. Okay, so this is very rare, but it can develop. Then coming to the cause. So what is the cause behind the formation of a thyroglossal duct cyst? So the thyroglossal duct cysts are a birth defect, so as we have seen before. So during embryonic development, what happens? The thyroid gland is being formed. So beginning at the base of the tongue. So moving towards the neck canal, it forms a thyroglossal duct. Okay, while the thyroid gland is being formed, thyroid gland is formed at the base of the tongue, but to moving towards the neck canal, it forms a thyroglossal duct. So once thyroid reaches its final position in the neck, this thyroglossal duct normally disappears. Okay, so in some individuals, what happens? This thyroglossal duct remains behind. So when it remains behind, it may leave small pockets which are known as cysts. Okay, so during a person's life, what happens? This cyst pockets can be filled with fluids and mucus. So when this cyst is filled with fluid and mucus and it is enlarged or infected, it presents into a thyroglossal duct cyst. Okay, so this is the cause behind the formation of thyroglossal duct. So it is a birth defect. So while thyroid gland is getting formed, what happens? While it is moving forward towards neck canal, it forms a thyroglossal duct. Okay, so this thyroglossal duct normally gets dissolved, but in some individuals it leaves a small pockets known as cysts. So these cysts, when they are infected with fluids and mucus, they form thyroglossal cyst. Okay. Then coming to the diagnosis, so you can appreciate the images here. This is the ultrasound and this is an FNAC image of the thyroglossal duct cyst. So the diagnosis, we follow physical examination, that is we find small mass along the midline section of the neck which moves while swallowing. So that is the physical examination. So we check the levels of thyroid function during blood testing, that is T3, T4, TSH levels, and we perform USG. So in USG you can see appreciate the lump here, and we take thyroid scan, and also we perform FNAC. So this is the picture of FNAC. Okay. Then coming to the treatment is surgical management only. We don't have any other treatment for this. So the surgical management, the options, the procedures, the kind of procedures that we perform include system procedure, en bloc central neck dissection, suture guided transhyoid pharyngectomy, Coempel's suprahyoid technique. Just remember these techniques. You can learn about these techniques in future classes. Okay. So the question they have asked in NEET MDS 2021 exam was, it was a clinical question. So they have asked like a child presents with swelling in midline of neck, okay, which moves on swallowing. So it moves on swallowing. So the probable diagnosis is it a brachial cyst, thyroglossal duct cyst, thyroid carcinoma, or cystic hygroma? So from the explanation above, we can arrive to the answer that it is a thyroglossal cyst, duct cyst. Okay. So if you like our video, do subscribe to our YouTube channel. You can also find us on Instagram at Dogshala for dental content and at Dogshala Medical for medical content. You can also follow us on Telegram. Thank you.